Welcome to my show. A guest here. His name is Todd Ehret. Mr. Todd, how are you doing, sir?
I'm doing really well. How are you doing today?
I'm fine, thank you very much, Mr. Todd. Firstly, you are a police captain. You're also a leader at the law enforcement organization, and you're
Yeah.
also a public immigration officer. Can you please, sir, discuss
I'm
more about yourself and how you're doing currently now, sir?
sure. Yeah, I'm a police officer. I've been a police officer for 27 years. I've worked at every role that we have in the department, from patrol to investigations to patrol lieutenant. And right now, I'm a police captain in charge of patrol operations, community policing, public information, and our behavioral health, mental health operations here. Been doing it for a while. Like you said, I big part of my role is public information officer. I do a lot of social media requests, talk to the media, issue press releases for major or critical incidents, as well as just community engagement stuff. So
All right, sir. Thank you so much, Mr. Todd. I want to dive more on the point of the law enforcement, sir. There will
sure.
definitely be challenges when responding to mental health crisis. Can you please
Yeah,
tell us what are the challenges law enforcement officers face when responding to mental health crisis, sir?
yeah, there is obviously, mental health issues are on the rise, and the unknown of what our officers are walking into, I think, is our greatest challenge there. Also, it's a challenge for the family because when we're responding to somewhere, it's a loved one. They have now gotten to the point where they're asking for help from the police department. In years past, the officers were not as well trained in how to handle a mental health situation. So they treated it much the same as they would treat anybody else that was having, an episode, I guess you would say. Um, they have to be handled differently. So you have to recognize that there's a mental health issue, and then you have to go and take certain steps to de-escalate, you know, the call you're responding to. So for our officers responding to calls that are usually mental health related, they can go from very calm to very aggressive. And a lot of times there are triggers that we might not be aware of prior to responding that can put our officers in danger. It can put the person we're responding to in danger as well.
Thank you so much, Mr. Todd. And there will also be, effective response. What do you personally think are some of the most effective response models for mental health crisis you've seen, sir?
I'm a big fan of a couple, and I'll tell you why. Obviously, having further training for our law enforcement officers in mental health response, number one, through crisis intervention training, just to give them a basic knowledge of how to interact with somebody that's having a mental health episode. And here, about 95% of our department is crisis intervention trained. Secondly, the model that I found that works the best is the co-response model, which teams a mental health professional. In our case, it's a clinical social worker who rides with specially trained officers, um, and they build a knowledge base about the call they're responding to through experience. They're in it together. You use the knowledge that the mental health professional has, as well as the knowledge that the police officer has, and through that model, I think that we kind of do two things. We are extending the knowledge of the officers that are responding to mental health complaints, and then we're equipping them with the knowledge that the clinician has through experience and through observation and through just being around how a clinician goes about de-escalating a call. The officers kind of learn, so we get a snowball effect, and it kind of like rolling downhill. The longer she's working with the officers, the bigger that knowledge base becomes. And secondly, I think that for the community, it provides an alternative response that you have a civilian there. So a lot of times somebody doesn't want to talk to somebody in a uniform. It might trigger their mental health episode to begin with. So you have both a civilian and a law enforcement officer there. Um, so you can kind of tag team it. You get both aspects, and it generally is a safer resolution for the person who's suffering the mental health crisis.
Thank you so much, Mr. Todd. And we all know that community always play a very huge role. What
Yeah.
role do you think community play in shaping alternative response to mental health crisis, sir?
I think it's imperative that you have the support of your community.
Hmm.
And part of that is being transparent with the community and explaining to them what this new um, this new model looks like and what they're going to be seeing from our officers and from the civilian that's riding with them. So a lot of it is a public information campaign, being transparent with the public so that we can get that community support. We found that a lot of our community is very, very supportive of having this response model, that it's affected a lot of people um, for the better, and it's gotten a lot of people help. So first and foremost, I think it's on the law enforcement agency to get out the information about what they're doing to kind of address the mental health crisis in their community. For us, it's the co-response model, and it works great. The more that you are out doing that and being transparent with the community and showing them how it works, they're going to learn as well. But a lot of that also comes from kind of going to community meetings and introducing your mental health clinician and explaining the role that she's going to play or he's going to play in the police department. Making them understand that they don't have to be afraid to call the police department when you're having an issue, that our officers are specially trained. And we do have a civilian that has got a high degree of education and a license to actually work with, mental health crises. It gives them the ability to kind of support what we're doing, but also the comfort to know that when we respond to your house, we have your best interests in mind.
And you also know that there will also be, barriers that the law enforcement agencies probably face at times implementing this alternative response. What barriers do you think law enforcement agencies face in implementing this alternative response strategies, sir?
Well, there are several,
Mm,
and a lot of them can be overcome with how you implement the program. You have to get the buy-in of your officers. Police officers for a long time, they felt that, we don't need civilians to help us with anything. And it's been shown through these programs that these public-private partnerships work really well. For us, it took a little while to get the officers to buy in. Now they're very dependent on that program. So that is part of it. It's how you implement the program. It's how you get your officers to buy into the program, make them understand that it's going to make their jobs easier. It gives them another tool in their toolkit to get their job done. But there's also the cost, and a lot of that is the agency has to do the research, has to apply for the grants, has to minimize the cost because we work in the real world of budgets. There's only so much money to go around, and we know that payroll takes up a large portion of a law enforcement agency's budget. So to be able to find the extra money to employ a civilian to do this kind of work sometimes takes a little bit of work on the agency's part to find a grant or to find the funding within the budget to be able to employ this person. I encourage it. I think it works well. I think that I've been in charge of it now for about a year and a half, going on 2 years. And if you asked me 2 years ago what I thought, I really didn't know. I didn't know the impact it was going to have on the community. So I'm happy to say a year and a half into it, I see some really major improvements from our people that we repeatedly have dealt with that are now getting help. So it frees up time for the officers, and it kind of minimizes the impact on the family, and it allows us to be able to actually help somebody where in the past we were just trying to solve the problem for that moment. Now we're able to solve the problem long term.
I'm also glad about that. Thank you so much, Mr. Todd. And
Absolutely.
there will also be lessons, your department, even you yourself have learned, implementing these alternatives. If you
Mhm.
can, what do you think are some of the lessons you, your department have learned from implementing this alternative mental health responses, sir?
Well, I mean, I think that the lesson first and foremost is we can't do it by ourselves. Don't be afraid to try an alternative method. For a long time, police agencies are kind of boxed in their thinking about we can do everything on our own. And as we see, we can't. So you have to get over that hurdle right away and say, we need some additional help. And a lot of that comes from just understanding what is best for your community and not being afraid to say, I want to try something different. That is one major hurdle to get the way of thinking away from we can do everything ourselves to we're willing to accept the help and see if this works. For one, the other is just the way that you implement it. Like I said before, if you just thrust it on your officers with no warning and no idea of how that program is going to work, it's probably going to fail. It's like any other initiative. When you implement something, you have to have, kind of like things laid out how it's going to work. And don't be afraid that as you start that program, if you need to make adjustments, that you do that and listen to feedback from your community because they're going to tell you really honestly how they feel about what you're doing. And for us, that was uh, once we got the program up and running, once we got the officers to buy in, as an administration, we thought outside the box and were willing to accept the help. And then we listened to the community and the good feedback we got kind of, is solidified that we're doing this in the right way. And I think that the important thing is you need to make sure you're helping people. If your program is set up and it's failing, it's really because you're not listening to the feedback from the people you're trying to help.
Thank you so much, Mr. Todd. And you definitely have stories, success stories
Yeah,
that are really, 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 that are really, really tremendous when it comes to this alternative response. Can you
sure.
please share with us probably a success story where an alternative response made a significant difference?
Yeah, I mean, honestly, there's a lot, and I think the first one that comes to mind is we had dealt with a person probably for months on end, probably 4 to 5 times a shift, so 8 times a day. But we were sending a car to this person's house, and it was clearly a mental health issue. He was not violent. He was not suicidal, but he was having a mental health crisis, and he would occupy a lot of time for our officers. And when we don't have somebody we have somebody who's not suicidal, then originally we were kind of hamstrung on what we could do with them. If you're not suicidal, we can't bring you to the hospital. So our officers will spend a large amount of time talking to this person, trying to make sure he was okay, only to leave and then get called back because we did not have the ability to link him with the proper services um, that we do now. I mean, our clinician responded early on in the program to that residence, was able to link this person with services, got him a caseworker, somebody that oversees his care. And now is what's January. We have not been back there since October of 2023. So we would respond 8 times a day for years, and we have not been back to his house um, since for a call since October of 2023. And at last check, he was talking to his case manager. He was attending counseling. He was following up on his medication appointments, and he's functioning regularly in society. And I think that when you talk about success in mental health, it's not illegal to be mentally ill in society. And it became a police response when we decided that we were going to kind of limit the government, resources for people that were mentally ill, and they put them on the street with not a lot of guidance and not a lot of support. So it was thrust upon the police department. But because we have these programs now where we're able to link them with the proper care, we're starting to see success in, not having repeat calls. They're healthier, they're functioning in society, their families are happy. So when you talk about success stories, that's the one that originally comes to mind because it was very early on, and it's what made me see the program for what it was and how it could work.
Thank God. Thank you so much, Mr. Todd. And for all the law enforcement leaders, they could be feeling or thinking, to also implement this similar, initiatives.
Mhm.
What advice do you think you have for other law enforcement leaders looking to implement similar initiative, sir?
My advice to them would be don't be afraid to take the first step. The first step is simply deciding that we can't do it alone, that these alternative responses they work. So don't be afraid to take that first step and at least consider the impact it can have on your community. If you look at it from a community centric point of view, that what you're doing is for the best and for the good of your community, then it becomes real easy to say, okay, let's see how we can do this. And just don't be afraid to do it. Send your officers to training. We send them to training for all sorts of things, but a lot of the they're dealing with has to deal with mental health. So don't be afraid to send them to CIT training. Don't be afraid to send them to mental health first aid. Increase their knowledge base. When you team that knowledge base with a trained clinician, you get a really, really successful program that can make a real difference in your community.
Well said. Thank you so much, Mr. Todd.
Absolutely.
And there is a question I normally ask Mr. Todd.
Sure.
From the ancestors, from the forefathers, there are a lot of things that do exist during our ancestral time that
Mhm.
is missing, in our time today. If
Yeah.
there is anyone or anything you would like to bring back to our time today, what do you think that thing will be, sir?
For me, I mean, right away, I'm going to tell you, I think it's that people should have respect for each other.
Mm,
We don't know what everybody's going through. People are judgmental. They lack respect for other human beings, and I think that in times past, that was much more present. I was born in 1973, and I think that when I was raised, I had respect for not only my family but other people because that was ingrained in me from my parents. And I think that somewhere along the way, the lack of respect for human beings amongst each other has kind of, subsided, and that's unfortunate. I think that if you look back in history, we treated our elders, we treated our family, and we treated other people with a much greater amount of respect. And now I think that's lost somewhere. So if I could bring one thing back, I would bring back that the human beings can treat each other with the respect that each other deserves and not be judgmental of each other. You don't know what that person's going through. You don't know what I'm going through. I don't know what you're going through. A friend of mine likes to say that we're all on a journey. We just don't know what part of the journey each other's on. So be respectful of that, and treat each other with respect that you would expect, how you would expect to be treated. And I think if we did that, we'd be much better off.
I completely agree, Mr. Todd. Respect is very, very important. It also even helps us, if we respect each other the way it has always been, we learn from each other. We have more discussion, there will be peace and there will be more fluent connection when respect is brought into place. I want to
Totally.
sincerely thank you, Mr. Todd, for this conversation. It was a
Sure.
very important one. Thank you so much, sir.
No, thank you for having me. And, I enjoyed our conversation. It's something I'm passionate about. And I'm always willing to talk to anyone who's looking to implement a program like this for their agency, or if they're a community member that wants to understand how it works so that they can bring it to their agency. I certainly would be willing to talk to anybody.
All right, sir. Thank you so much, Mr. Todd. Bye
All
bye.
right. Bye bye.